Thank you for joining me today. In this video, we are going to learn more about Lexapro, Escitalopram. Lexapro is a SSRI medication. Lexapro is antidepressant medication, but also treat anti-anxiety medication. It is FDA approved for major depression disorder and general anxiety disorder. Lexapro is well tolerated medication for anxiety medication. Lexapro it Lexapro is FDA indicated for general anxiety disorder and major depression disorder and general anxiety disorder, and it's commonly used off-label for other anxiety disorder and mood disorder. Common off-labels of Lexapro it include panic anxiety disorder, social anxiety disorder, OCD disorder, obsession compulsive disorder. Also, Lexapro is off-label use the PTSD. Also, Lexapro is used the premenstrual dysphoria disorder. Mechanism of Lexapro is that it selectively inhibits the serotonin transport. It decreases serotonin reuptake into the presynaptic neurons, and it increases the serotonin availability within the synaptic cleft, produces downstream adaptive changes in the serotonin signals. The therapeutic of Lexapro is antidepressant and effective develops gradually. Pharmacokinetics of Lexapro include that it's administered orally and it is absorbed well, and it effective can be taken without food or without food, so it is effective either. Potential binding is approximately 56%, and it is metabolized in the liver. Major enzymes that work with Zoloft include KCYCP219 or KYP or CYP3A4 and CYP2D6. Those are the major enzymes that involve Lexapro. Half-life of Lexapro takes approximately 27 to 36 hours, so it takes a long time to eliminate it for half of the Lexapro. Elimination of the Lexapro happens hepatic and hepatic metabolism with renal and fecal elimination of the metabolism. Doses is usually once a day. For adult dosage, major depression disorder typically start with 10 milligram once a day, and usually it's increased and titrated for more therapeutic range, with is 10 milligram to 20 milligram per day. Maximum Dose that you can prescribe is 20 milligram per day. For general anxiety disorder, typical starting dose is 10 milligram per day and may increase to slowly to 20 milligrams a day. Those increases should be based on clinical response. You want to increase only if you think the 10 milligram is not improving the mood or the anxiety. For adults, recommended dose is 10 milligram a day. For older adult, maybe increased exposure and general sensitive to the side effects. So older adults are more sensitive to the medication because their elimination is lower, and it's recommended 10 milligrams of Lexapro, and that lowers the risks adverse effect of the medication. Patients who have liver impairment, hepatic impairment, recommended dosage is generally 10 milligram per day. Use cautiously because liver impairment can increase the exposure. Renal impairment, no routine renal impairment assessment, and is generally required for mild to moderate renal impairment. You should use cautiously in a severe renal impairment because the clinical data are limited. For therapeutic response for Lexapro, patients may notice early changes in sleep, mood, anxiety, and energy. So they may feel improvement for the energy, sleep, appetite within 1 week or few weeks. However, meaningful antidepressant response commonly require 4 weeks to 8 weeks. Some anxiety disorder may require longer than that. Common adverse effects include GI symptoms, neurological, sleep, sexual dysfunctions. For GI adverse effects include diarrhea, nausea, vomiting, constipation, and neurological common adverse effects include headache, include dizziness, include tremor, include sleep disturbances such as insomnia and somnolency. For sexual dysfunction, it includes delay libidos, delay organism. Sexual dysfunction can persist during the treatment. For important adverse effects, that serious side effects that Lexapro can cause is serotonin syndrome. Risk increases with Lexapro is commonly with other serotonin medications. Medications that increase the serotonin can also increase the risk of Lexapro. Symptoms of serotonin syndrome include the agitation, irritability, confusion, tremors. It includes the high temperature, diarrhea. Severe serotonin syndrome is require medical attention and medical treatment because it's medical emergency. Lexapro can increase the suicidal ideation in children and teenagers and young adults. So caution, particularly in the initial treatment or the dose adjustment. So you want to monitor for new suicidal ideation or thoughts, increased agitation, irritability, impulsiveness, and behavior changes and behavior activation. Selective may precipitate mania or hypomania. You want to assess symptoms of mania or hypomania or mood swings. Therefore, you want to screen for bipolar before you prescribe or initiate Selective and Lexapro. Antidepressant medication monotherapy should be generally avoided for bipolar disorders, especially bipolar 1. Lexapro can lower the sodium. Medication is in this category of SSRIs, can decrease the sodium. Syndrome of inappropriate antidiuretic hormone secretion and hyponatremia can happen. High-risk patients that can develop syndrome of inappropriate antidiuretic hormone secretion and low sodium include the older adult, patients who already taking diuretic medications, patients with previous low sodium, patients with medical comorbidity. Symptoms that you want to monitor and watch for include headache, nausea. Those are the symptoms that low sodium can have. Headache, nausea, confusion, weakness, and seizure in severe cases. Also, Lexapro can increase the QT prolongation. It has the QT prolongation. Lexapro can cause, even though it's dose dependent, can increase the QT prolongation. So you want to monitor, and the risk gets greater. QT prolongation risk can get greater in high doses. If the patient is taking high doses, like a 20 milligram that we talked about, QT prolongation risk is increased higher. For elderly who it's hard to eliminate the medication, QT prolongation increases. Electrolyte abnormality, patient who has electrolyte abnormality can increase the risk of getting that QT prolongation. Congenital lung QT syndrome can also precipitate that. Patient who has a cardiac disease is risky for getting that QT prolongation. Other medication, if the patient is taking medication that also has QT prolongation, with the Lexapro, side effect can increase. You want to consider and you want to do the EKG monitoring in the patient with significant risk factors. Also, Lexapro can increase the bleeding risk because it impairs the platelet aggregation. So if the platelet aggregation is affected, it creates bleeding risk. Bleeding risk may be increased with the combination of the aspirin, NSAIDs, anticoagulant or blood thinner medications, and antiplatelet medications can increase the risk of bleeding risk. Discontinuation of a syndrome indicate the patient do not discontinue the medication quickly and can cause, if you discontinue the medication quickly, it can cause dizziness, nausea, headache, irritability, anxiety, insomnia, flu-like symptoms, sensory disturbance. So gradual tapering is usually recommended. For drug-to-drug interaction, major contraindication for Lexapro include monoamine oxidase inhibitor or MOA inhibitor medication, which is antidepressant medication. Combining Lexapro with monoamine oxidase inhibitor can cause serotonin syndrome, can cause severe aerodynamic instability, can lead to potential life-threatening complications. An appropriate washing period is required with switching between these medications. So when you want to start Zoloft or Lexapro or SSRI medications with the patient already taking monoamine oxidase inhibitor, you have to stop that and then take 14 days. 14 days of washout period has to be between these medications. Other serotonergic agents that you want to use cautiously include tramadol, other antipsychiatric medications, certain migraine medications, linezolid, meth, Johnson water, which is supplement. For pregnancy mothers, Lexapro can be considered during the pregnancy when treatment is indicated. But you have to weigh the risk with the benefit and assess, and the assessment should be considered for the severity of the mental illness, for the severity of the mother illness, for previous medication, if the patient have been using this medication before they get pregnant, or if this medication worked for them before. Potential, you also want to assess and wait for the risky to the infant and adaptation symptoms, because this medication Lexapro can pass to the infant. Potential pregnancy complications, do not quickly do not discontinue quickly for the antidepressant therapy solely because of the pregnancy without individual assessment. Lactation, Lexapro can pass into the breast milk. If used during breastfeeding, you want to monitor from the infant. If the infant is sedated, if the infant is having, or if the baby is having difficulty feeding, if they are irritable, if they are poor gaining weight or growth, if that's going to affect their growth. Baseline evaluation, protein lab testing is not required for Lexapro. You want to also consider if they have any medical history, medication interaction. You want to review that medication interaction. You want to also assess the suicidal ideation for Zoloft. You want to assess if the patient has a bipolar disorder, and you want to screen that before you prescribe Zoloft. You want to assess the electrolytes when indicated, and you want to screen cardiac disorders, and you want to use the EKG when cardiac disorder, when the patient has a cardiac disorder, or if they have QT prolongation risks. Ongoing monitor to assess is you want to assess the patient for psychiatric disorders such as depression symptoms, anxiety symptoms, suicidal ideation, mania or hypermania, functional impairments or improvement. If the patient is taking the medication, you want to assess if the medication improves the functional, and it improves the symptoms and lowers the symptoms. You want to also assess the medication compliance, if they are adhesive to the medication and taking their medication. You want to also assess the GI symptoms, sleeping changes, sexual dysfunction, hyponatremia or low sodium symptoms, bleeding risk, QT prolongation. Those are what you want to assess. Thank you for joining me today. I would love to see you my next video. Please subscribe and join me again. Thank you.